by Newman Regional Health. Quality healthcare close to home. That's Newman Regional Health.
KVOE 1400 AM and 96.9 FM present The Talk of Emporia, bringing you local issues, topics, and events of the day.
And welcome to The Talk of Emporia on this Monday, and this is our Central Care Cancer Center Day. Of course, once a month we feature Central Care Cancer Center. You've been hearing a lot from Dr. Perez Tamayo over the past year and a half, and Dr. Tamayo will still remain with us. They've provided just a ton of great information about basically every kind of cancer, and we certainly appreciate Central Care Cancer Center stepping up and providing us with all the great information and details. But today, we're going to take a bit of a different tack because we're excited to welcome to Central Care Cancer Center in Emporia, Dr. Ali Wazir, who is a medical oncologist and hematologist. And first, Dr. Wazir, welcome.
Thanks for having me.
It is great to have you here. So you are right across the street here in Emporia, huh?
Yeah, it was a short walk, and it's a lovely day today. So, I'm glad that, I'm here.
A lovely day, and we're very fortunate to have you here in town and at Central Care Cancer Center right here in Emporia. I guess new medical oncologist and hematologist. Well, let's talk about Dr. Wazir. First, a little bit about your background, where you come from, and a little bit about your medical education history.
Yeah, so, I'm originally from Pakistan. I was born in the country of Kuwait, and my father was a surgeon, and he had to move to Pakistan during the Gulf War. And I grew up in a family of doctors. It's not very atypical of like a lot of families, from Pakistan, where a profession kind of runs in the family. And I grew up with that, and then I went to medical school in the coastal city of Karachi, which is like the biggest city of Pakistan. It's called the Akhan University. And after that, I did a bunch of rotations in the country, gave my board examinations, and, ended up in medical residency in Albany, New York. And I did my residency in Albany Medical Center in New York, and then I was the chief resident there at their VA, where I worked for a year. And then after that, I did my hematology and oncology fellowship training at Upstate University in Syracuse, New York.
What drew you to oncology in the medical field? Yeah,
it's a tough question. Honestly, my dad was a surgeon, and he dealt with like a lot of surgical oncology. So, I always had that in the back of my mind that, it's always a challenging set of patients, and so initially when I was in medical school, that was the thought, that, okay, maybe surgery is the way to go. And I came to Atlanta, and in Atlanta I worked at Grady Memorial Hospital for my sub-internship in trauma of all things, And, the more you kind of see, surgery, I got to work a little bit in, surgical oncology. I saw that, that patient population, it's very challenging, and they have, they need a lot of care, They're very different from other sets of patients, You need a whole team of radiation doctors, medical doctors, therapists, and, it's a whole different type of healthcare that they get. And then, I kind of realized in myself that, I was more drawn to internal medicine and medical oncology. And when I got into residency, we had a leukemia unit in Albany as well, which was run by residents. And, working with those patients, I was like, this is a set of patients where, you can make a difference, you can work with them for a long time. It has a lot of, big array of patients. There's some patients who'll have like something minor, they'll have surgery and, some therapy, and after that, they're cancer free. And for some patients, it's their final diagnosis, and they may live with it for many years. Or it may be something that's more abbreviated, and they need someone to help them through that process. So, that's what attracted me to oncology.
Sounds like the medical field was in your family, so there was no other route to take then, really, for you?
Yeah, no, that's what my dad said. He'd quote, what's the guy who made the first car?
Henry Ford?
Henry Ford, you can get any car, but it has to be black. So the same thing, he was like, you have to be some kind of surgeon, and, I decided not to become a surgeon, to his great disappointment. Somewhat disappointment, I'm kidding, but yeah. So yeah, that's true. All of my siblings did go to medicine as well. So
how did you land here in Emporia? It
Yeah.
sounds like you've had quite a journey.
Yeah, so after that I did fellowship. I actually went up and down the country trying to find a practice where I thought I would be a good fit. Because like even after you become a specialist, like they're different kind of specialists. Some of them are in
Sure.
like big universities and they want to do research, and some of them want a more clinical practice. Some of them want to work in a big community, small community. And when I interviewed at Central Cancer Care, it really struck me as like, a organization that, has really committed that, these smaller communities, they need good cancer care and they need comprehensive cancer care and they need someone right there who can like take care of things. And like what really struck me was like they have like very long partnerships with these other institutions. And good relationships in the community. So, overall, I like the culture of it. I like the fact that they knew their vision. They're very clear about it. There's no, like, kind of like going through this middle path of this and that. They knew the market and everything. So, it all felt really right for me. So, it was an easy decision in the end of the day.
Being in a small market like this, it can also a lot of times be difficult, to recruit, quality healthcare professionals here. What about the facility itself, technology? Is it good at Central Care Cancer Center?
Yeah, well, that's a really good question. So, like the most important thing for, even in training, like I kind of realize is the most important thing for any organization is to know that what's their niche, right? And, we are focused on a lot of benign hematology, a lot of solid oncology. And for that specific niche, like, they have done all their homework. They know that the imaging modalities, the treatments, the chemotherapies, like all those systems are set up so they can get like the highest standard of care. But then again, there's some cancers that are, either too rare or somewhat complex to treat, especially some types of leukemias, etc. That, like you don't want to do like a half good job, So I think it's very appropriate for those kind of patients to be treated at like only certain centers in like bigger cities. So I think, to answer your question, like, I think they have, thought about their market and their niche, and for that they have provided, they have a good system of like providing that care. But yeah, of course, there's some cancers that, it doesn't make sense to treat them out in the community,
Well, that's something you would recommend then for the patient, correct?
Absolutely. And the good thing about it is that they have a good referral network. They know, like, for example, like, let's say there's a patient who needs, a stem cell transplant, for example, or CAR T therapy, So, you have facilities in Kansas City, not far from here, and good relationships, of the organization with, those specific doctors who only see those kind of patients and can provide those services. So just to answer your question, yeah, there is, like with us, like there is a way to kind of like funnel those patients to where they need to be.
In talking with Dr. Ali Wazir, he is a medical oncologist and hematologist, new here to Central Care Cancer Center in Emporia. Well, let's break it down here, Dr. Wazir, and maybe give us a brief overview of what hematology and oncology is.
Yeah, so, the brief answer is that these are two separate disciplines, but there's a lot of overlap. So that's why in America, they're both kind of lumped together, right? So oncology is the study of cancers, right? And medical oncology is like the medical side of it in the sense that, you aren't dealing with the radiation and the surgery. Whatever is left falls into medical oncology. And the interesting thing is that, most other kind of doctors, they are specific to a certain organ system or part of the body, like you have cardiologists, you have pulmonologists, you have endocrine doctors. Oncologists are specific to a certain disease, so that makes them very different from other doctors in the way they look at things, because cancer can arise from any part of your body. The same person has to be trained in dealing with cancers of the skin, melanoma, to brain cancer, to lung cancer, to you name it, rarer cancers of the immune system. So that's the oncology part of it. The hematology is a bit interesting because you have a lot of blood disorders that are not cancer not cancerous, right? So some patients can have like low platelet counts or low, anemia for whatever reason. And there's a whole set of diseases that can cause that have nothing to do with cancer. We put it under this umbrella term of benign hematology. So that's like almost 50% of the practice. And then, the other 50% in hematology is to treat cancers of the blood and lymphomas. So lymphomas and the cancer of the blood, which are called leukemias, they're kind of like bundled together. So hematology is, treating the cancers of the blood, leukemias and lymphomas, along with benign hematology, which we talked about, patients who have anemia for whatever reason, sickle cell disease, et cetera, et cetera.
And talking with Dr. Ali Wazir, he's the new medical oncologist, and he's a hematologist with Central Care Cancer Center. This is the Central Care Cancer Center Talk of Emporia. Comes your way the second Monday of every month. Let's pause and take our first break. This portion of the Talk of Emporia brought to you by Bobby D's Merchant Street Barbecue, still offering convenient carryout and curbside services. Bobby D's, where it's always all about the meat. And by Central Care Cancer Center. Cancer care close to home, 1401 West 12th. For more information, call 620-342-1117 or online at cccancer.com.
At Central Care Cancer Center, we provide you with complete cancer care, such as chemotherapy and radiation therapy, all under one roof. Emporia is our home, too. That's why we're dedicated to bringing expert care to you, so you don't have to travel far. We're located right next to Newman Regional. Dr. Elamine, Dr. Perez Tamayo, and our amazing staff are all ready to assist you. Call today for an appointment, 342-1117, online, cccancer.com. Telehealth and second opinions available.
Bobby D's Merchant Street Barbecue wants you to know how much they truly appreciate your business and look forward to you stopping by for some tender, juicy, fall-off-the-bone ribs or enjoying the best smoked meats in the Flint Hills. Bobby D's is open 11 to 8 Monday through Saturday. Dine in at 607 Merchant or call 620-342-1990 for convenient carryout or curbside service. And check out their new specials on Facebook. Bobby D's Merchant Street Barbecue, where it's all about the meat.
All the latest sports news with Greg Ray. 14 KVOE, 96.9 FM. Live and local. You're listening to the Talk of Emporia. Your questions are welcome. Call the KVOE Sutherland Studio Line, 620-342-5863. That's 342-KVOE.
And welcome back to the Monday edition of the Talk of Emporia. This is the Central Care Cancer Center. Talk of Emporia. We're very pleased to have Central Care Cancer Center on with us monthly, the second Monday of every month. And we're very pleased to be joined this morning by Dr. Ali Wazir, a medical oncologist and hematologist here, now at Central Care Cancer Center here in Emporia. And we can't stress enough how fortunate we are to not only have Dr. Wazir here with us, but Central Care Cancer Center providing the services that they do here locally. That really is a comfort to a lot of folks that are dealing with this terrible disease. Well, Dr. Wazir, again, welcome to the program. It's great to have you here. Let's talk about the services offered at Central Care Cancer Center. I mean, what specifically do you provide for folks here that may look at Central Care Cancer Center?
Right. So, we get referrals from Newman Medical and other providers in the area. So, the general way this works is that, there'll be other doctors who'll come across patients who'll have a number of diseases that they need help with, right? It could be something benign, like we talked about, like a clotting problem or low blood counts or what have you, and that needs to be investigated. Part of our training is to kind of do that investigation to figure out why something's happening. Or someone could have a lump, somewhere in their body, or a new mass or a new growth. And we can help those doctors tell them that, hey, we need a biopsy, or, maybe there's something that we can see in 3 months to see how things are going. Once that biopsy is done and our pathologists, they kind of look at things, then, you get a diagnosis. We call that a tissue diagnosis. In the field of oncology in particular, that's very important to have a tissue diagnosis, because that point kind of decides, what happens to the patient. The part after that comes is that once you get the tissue diagnosis, you need to have staging scans, right? You need to know if the cancer is an earlier stage cancer or a later stage cancer. for the earlier stage cancer, generally speaking, you can have like other therapies that may be more important than the chemotherapy to start off with. It could be potentially curable. They may need to see a surgeon or a radiation doctor. And we do provide radiation services at our location in Emporia. And, we have a really dedicated and good staff, very good doctors, dosimetrists, physicists to kind of like make those plans and help us with that. Sometimes you fall into a situation where you need to give both chemotherapy and radiation together because there's some certain chemotherapies that can kind of like juice up the radiation, if that makes sense. And both of them together are much more effective than either one of them. Apart from that, then you have more advanced cancers where like chemotherapy, you want to treat the cancer all over the body, and chemotherapy is the way to go. So, we do have at Emporia, a very good infusion unit. I was there this morning, and like staff for the whole week, along with nursing staff, which has been there for oncology nursing staff, which has been there for a long time, know how to deal with infusions and what that entails. And we do have like our own pharmacy for like some chemo drugs that are oral drugs to dispense to the patient, send it to their homes and that. So I think facilities wise, that's a big thing you look at during interviews. It's all under one roof. It's not very fragmented. That okay, for this you gotta go there, and for this you gotta go there. So that's a good thing that institution kind of keeps it all together. As much as possible.
So is it good to have Newman Regional Health adjacent to you, so close?
Yeah, actually, I went to their annual, they have this annual kind of like fundraiser.
Denim and Diamonds, yeah.
Yeah, Denim and Diamonds. I wasn't dressed in denim, but, I did come there, and it seemed such it was a lovely, lovely night, and everybody was having a really good time. And, I'm not very familiar with, the individual doctors and Newman Medical, I'm just starting out over here, but, just the impression I got is that, it's like a small community of physicians who are trying to do their best, provide, the best possible care they can, and retain, try to make sure the patients get the care closer to where they live.
Yeah, it was a great night. I was there I was emceeing the event that night. So, over $200,000 raised. So
wow.
Good evening, yeah. Good night. Well, Dr. Wazir, let's talk about your patient care philosophy. How do you deal with your patients?
Yeah, this is a very interesting question, and there's a lot of like books written by like cancer doctors like towards the end of their end of their careers, where they kind of reflect on this, and it seems like there are some trends, part of being an oncologist is that you need to kind of like you're a guide in a sense, right? In the end, the patient has to make his decisions, and these are hard decisions, very hard decisions.
Yeah,
and your job is to give the right information, the right context, but at the same time, you don't want to give them just like print out like some scientific study and just hand it over to them and just give them a lot of numbers that may sound stark. Like you have to kind of like explain the data that makes sense to that person right there, right? Like I was listening to a talk, for example, like, there's some cancers, unfortunately, where the outcomes aren't so good, right? So, like there's a number we sometimes quote, is called the median. Like, if you take 100 people, like what's the middle number? Like, how long, for example, common question is that, doc, how long do I have to live, for example, right? It's very hard to tell. It's impossible. So, the doctor in the talk was saying that, the median number we quoted all the time, but for some cancers, you want to quote the number that, hey, in 3 years, how many patients are alive? And you'll be surprised, these numbers can be very different from each other. There's sometimes cancers where, only a small subset, they're like some patients who, if they pass the 1 year mark, like they're going to do well. Right? Mm-hmm. Versus some, some of the patients don't do so well, and they bring the whole number down, like the median, the middle number, it comes down from it. So that's a big part and challenge of oncology, like talking to the patient, like explaining to them that, this is it, and kind of sensing it out. There's some patients who are like, hey doc, I trust you, whatever you say, that's it. Like, I don't want to get into the sticks of it. And then some of them who like have read up on it and have gone to Dr. Google and know all the studies and know, sometimes they know stuff that you haven't heard of yet, and they have somehow, through, which is very important, patients, communities online and everything. So yeah, it's a challenging thing, but I would say in my personal, just to like kind of like sum it up, I would say that you want to keep open lines of communication. You want honesty with the patient and be realistic, be always realistic with them. But at the same time, you want to like see like kind of sense that like what do they need to know at this time, like how much do they need to know. And kind of like guiding them through that journey, and everything, because we see patients when they're on treatment, like every 3 weeks, every 2 weeks, like no one sees, we're probably the doctors who see our patients the most, because of the chemotherapy and everything. So sometimes you have to spread this message out, it's like, okay, now they need to know about this, now they need to know about this, they need to know the next step, what to expect, how bad is this chemotherapy be, are they going to lose their hair, are they going to have nausea, the side effects. So, the answer is long because it's a complicated kind of thing to answer.
Well, there are so many questions to be answered, and you're dealing with, for the most part, life or death situations here. And honesty, I would suspect, has to be right up there on the top. I would assume compassion has to be provided as well. And giving false hope, you have to pull yourself back from that sometimes.
Yeah, no, absolutely. And the thing about hope is, it's probably one of the most like complicated issues in cancer, right? You don't want to give false hope, right? But there's some things where you can be somewhat hopeful. Sometimes we always have those patients who like beat the expectations, but that's not every patient. So it's a very it's a fine balance. You have like these two forces where you have to. But the way you described it is exactly it. Like you want to be honest, you want to keep open lines of communication. And you wanna, if hope is reasonable, you need to, of course, like let them know, because you want them to have quality of life, not just quantity, and they cannot spend their life just coming for therapy. Like a lot of times, we'll have patients on therapy for many years, and I tell them that. What's important right now for you is to have a normal life. If you have to go to Florida, don't worry about it. We'll figure out there's cancer doctors up and down the country, Like you don't have to like structure your life around your diagnosis. You need to live a normal life as much as possible, as long as possible.
Well, when we come back, we have to take one more break. Dr. Wazir, come back. I'd like to talk about, the technology and its advancements over the years. It seems like, cancer treatments have come a long ways over the past 5-10 years. I think we'd like to touch on that just a little bit and ask you a few more questions before we let you go. This is the Talk of Emporia, brought to you in part by the First Christian Church, where all are welcome and have a place at the table of love, and by Newman Regional Health, quality health care close to home. Newman Regional Health.
At Central Care Cancer Center, we provide you with complete cancer care, such as chemotherapy and radiation therapy, all under one roof. Emporia is our home, too. That's why we're dedicated to bringing expert care to you, so you don't have to travel far. We're located right next to Newman Regional. Dr. Elamine, Dr. Perez Tamayo, and our amazing staff are all ready to assist you. Call today for an appointment, 342-1117, online, cccancer.com. Telehealth and second opinions available.
First Christian Church at 202 East 12th Avenue invites you to come shop at our clothes closet and household hut on Fridays from 3 to 6 p.m. and Saturdays from 9 a.m. to noon. Funds raised from our clothes closet and household hut go to support our food pantry, which is open every Monday from 9 to 11 a.m. You're also invited to worship with us on Sundays at 10:40 a.m., either in person or on Facebook. You are welcome at First Christian Church.
With the new school year approaching, don't put off your student's school or sports physical until it's too late. For just $25, the team of providers at Newman Regional Health Medical Partners can help you prepare for the upcoming academic year and sports season. Schedule a school or sports physical with a Newman Regional Health Medical Partners provider today. Call 620-343-2376 or visit newmanrh.org/physicals for more information.
The Emporia Farmers Market.
Is everything in place?
Twice a week. Wednesday evenings and Saturday mornings in the parking lot at 7th and Merchant. Go. KVOE 1400 AM, 96.9 FM. Grown, live and local. You're listening to the Talk of Emporia. Your questions are welcome. Call the KVOE Sutherland Studio Line, 620-342-5863. That's 342-KVOE.
And welcome back to the Talk of Emporia Monday edition. This is the Central Care Cancer Center. Talk of Emporia, heard the second Monday of every month, and we're very fortunate and pleased to be joined this morning by Dr. Ali Wazir, medical oncologist and hematologist, new to Central Care Cancer Center here in Emporia. Again, Dr. Wazir, thanks for being here, taking time out of your busy schedule. We appreciate that. We know how busy you are, so it's good to have you here.
No, thanks for having me.
Well, let's talk about the advancement in technology treating cancer over the years. It's obviously, in listening to Dr. Tamayo over the past couple of years here on this program, it seems like cancer treatments have come a long ways, have they not?
Yeah, no, I mean, it's kind of interesting. When I was a resident in Albany, so we get this journal, which is like the premier medical journal for like all medicine doctors, even surgeons. It's called the New England Journal of Medicine.
Okay.
And it only publishes like things that actually make a big difference in patients' lives. So that means, either they live longer or cures their disease and this and that. And honestly, if you look at the journal over the past 5 years, almost every other issue has some breakthrough in a certain cancer. So it is extremely exciting times. Like I cannot explain like how big a change this is. Like cancer therapy. If you just want to go into the history a little bit in America, there's this hematologist who was trained at Roswell Park, where I actually worked for a little bit. And after that, he moved to Boston, and he was working at the basement of the hospital at Harvard,
Okay.
Brigham's hospital. And at that time, leukemias of children was like a death sentence, like no one would recover from it. And he basically figured out that you could use certain chemotherapies to kind of fight leukemia, and combinations of therapies to fight leukemia. And that was the 1960s, and after that, what happened was there was this explosion of chemotherapy drugs that were discovered. The NIH basically sent teams all over the world to collect different plants and what have you, and they tried them on different cells. And that's the part of history where we got most of our chemotherapy regimens, from this period from the 1950s to the 1970s, the early 1970s. But then after that, in the 1970s to the 1990s, there's no big development in oncology, unfortunately. If you're very honest, there weren't any big breakthroughs. There's a lot of fine-tuning, and there's some breakthroughs in certain cancers, like testicular cancer, for example. But there's nothing game-changing that happened. What changed all of this is that, a lot of research, billions of dollars went into figuring out the basis of cancers. Why do certain people get cancers? And they figured out that, there's certain mutations, there's certain things that happen to the genes of cancer cells that give them this immortality, the fact that, they just wreak havoc, and they're able to spread to different parts of your bodies and just distort the architecture of your body, how it's meant to work. And once they kind of figured out those mutations and stuff, they were able to figure out that there's certain drugs that can target these mutations. So that's the one big part of the revolution in cancer. Where, if you have lung cancer now, they're not all the same disease. We figured out they're actually 11, 12 different kind of disease. And they have their own mutations. And for some of them, you don't need chemotherapy. The right treatment is just to give you a pill, send you home with that pill that just targets that mutation in the lung cancer. And you can have many years of life where you're just taking a pill, just like a blood pressure pill or any other pill. So the power of that is very strong, and a lot of other cancers, apart from lung cancer, where they found these mutations, which made a big difference. The other thing that kind of became a big issue was in the late 2010s. They figured out that your immune system of your body why does it not recognize your cancer and fight it, right? It's kind of been designed, the immune system, to kind of look at your body and figure out what part of your body is yourself and what is foreign, like what is bacteria, what are foreign pathogens. Sure. And they figured out that the immune system does recognize cancer, but the cancer figures out a way of hiding from the immune system. And this has just opened up this huge field of oncology, which is called immuno-oncology, where you use the immune system of the patient to kind of fight the cancer. And I think this is the second rung of what has made cancer therapy revolutionized over the last 10 years. Those two things together have made a big difference. And of course, there's always the better mousetrap kind of situation where they made better PET scan machines, better CAT scan machines, better screening, which is also happening in the background. So, those are the two rungs technology-wise in medical oncology, immuno-oncology and targeted therapy, as we call it, of targeting specific mutations that have made the biggest difference over the last 10 years in cancer care.
How important is getting the information out to the public about, knowing signs, knowing symptoms, catching cancer early, or knowing what may cause a problem, what might not?
Yeah, so I think that is the most important thing. And I mean, that's honestly the reason I'm here, at this radio show, because I cannot stress this enough. We did talk about all this new technology and cancer and this and that, but if you look at it, the biggest difference is prevention and catching it early. If you want to make a real difference in a lot of patients' lives, the two things you got to do is you have to educate them about certain behavior, certain things people do that make them more cancer prone, namely smoking, chewing tobacco, other things that can increase your risk of cancer. But then the part is that, if you have risk factors, you need to get the screening, because I cannot stress it enough. If you get caught with cancer early, if it's a spot that can be removed, if it's something small that can be just dealt with, that makes the biggest difference, because for all cancer, doesn't matter what kind of cancer, the biggest difference is at what stage do you diagnose it. If you catch it in early stage 1, stage 2, sometimes stage 3, for a lot of cancer, that's a curable proposition, right? The surgeries are more minor, the radiation field is smaller, so catching it early, that's very important. And I know this is probably not the the focus of this talk, and hopefully I can be back here to talk a little bit more about it. But the ones in which it makes the biggest difference is colorectal cancer. You gotta get your colonoscopies in. The American Task Force for Preventive Medicine has updated their guidelines. At age 45, everybody needs a colonoscopy. It used to be age 50, because we are having young people who are dying from widespread colon cancer. We haven't figured out exactly why. It must be a host of reasons. But if you are 45 years old and you're listening to this, you need to go talk to your primary care doctor, get your colonoscopy in. It just has to be done once every 10 years for most patients. It's, I know it's a hassle, but, free up time on your schedule, just get it done. The second part is, we are here in Kansas. It's pretty sunny out here. It's really hot. If you are in your 40s and, you go to the beach and, you're exposed and everything, just make sure you see a dermatologist at least once a year. If there's a mole on your body that has changed in size and shape, that has a different color, different borders, you need to have that checked out. Don't let it fester for the next day. And the last one I'll talk about is that if you are a smoker, within and you have quit within the last 15 years, let's say, now there is actually low-dose CT scan that you can have done every year, and this is the recommendation, that you can have that done and it'll pick up spots early. And as I said, if it's caught early, it's a much different problem to deal with as opposed to something that's very advanced.
Very good information, and we'd love to have you back here on the program again. So hopefully we'll be able to, yell across the street and get you back over here, Doctor.
Yep, absolutely. Sorry, I just had also your breast screening. That's very important as well.
And they do. I think you have great breast screening at the Jones Breast Care Center over at Newman Regional Health. Well, Dr. Wazir, thank you so much for coming in. Great information. It was nice to meet you, and welcome to Emporia, and we're fortunate to have you here.
Yeah, thanks for having me.
Good show here. Dr. Ali Wazir, medical oncologist and hematologist with Central Care Cancer Center on our program. And Central Care Cancer Center will be back next month, second Monday of September, with another